the mother of 3 educated children. Miss Sarah Dager. Next is a woman who roughly a year ago transitioned from her workplace in the legal world to one amid the friendly skies, and who several years ago shared her experience with us and her perspective through the MGH Cancer Center Story Project. Ms. Iris Martinez. A gentleman whose education includes multiple degrees, his career has been committed to equality everywhere from corporate boardrooms to community classrooms, and whose hobbies and interests are those of a true Renaissance man, Mr. Guillermo Cuellar. On the other side. Okay, watch your step there. And finally, a young lady who is a rising senior at Dean College and a talented singer and songwriter, Miss Grace Van Dyke. Thank you so much for being here, joining us to share your journeys and how you found meaning in those respective journeys. And Sarah, we'll start with you. I've given a very brief introduction. Tell us a little more, or a lot more, in your experience. What brought you here? Why are you here today?
Well, I can say the reason I'm here today is I'm a professional patient, and this is my first experience not being at a professional conference speaking, so bear with me with my nerves. My name is Sarah Dager. I'm 55 years old. I live in Methuen, and I'm a 2-time cancer survivor. I have 3 children, ages 27, 24, and 20, and happy to say they're almost all educated. I have one daughter in medical school. I also have a 1-year-old Bengal cat, who is just like having a toddler who will never go to sleep. I have a bachelor's degree in mathematics and computer science, a master's degree in energy engineering. I've been working in the energy industry for over 27 years. The past 14 years, I was a consultant doing projects for big commercial customers, kind of helping to manage their multi-year energy plans. As Bob said, I'm a competitive rower. I have been for the past 7 years. I'm now rowing with the We Can Row program out of Boston, which was founded in 2002 for breast cancer survivors, really as a way to help them with lymphedema and so forth, and to learn to row too. And it's a great journey, spiritual kind of aerobic sport. And I've been I grew up as a gymnast. I was a hurdler, a hiker, a swimmer. I even did hang gliding. So I'm a little bit daring. And so that's how I kind of come into the next part of my story, which is my cancer diagnosis. So I think my journey actually started when my mother died in 2006 of her 2nd round of cancer. Her first round was breast cancer. And her 2nd round was a cancer that was the HER2 neu2. She had very aggressive chemo. And at the time, I was busy with my family. I lived 4,000 miles away. I grew up in the state of Washington, Walla Walla, Washington. And so I didn't really get to experience her pain and suffering that much, her journey. I didn't know what to ask. I didn't know how to react to it. And then I didn't understand the trauma, what she was going through. So I was looking at it through my peripheral vision. And then I ended up in 2010 after seeing some specialists about another problem I had with my breathing. And I ended up seeing my OBGYN to see if something was related to my hormones, something was going on. And I guess it was time for my breast exam. So we did a breast exam. And lo and behold, I found out I had breast cancer. So then I decided to go to Mass General. Dr. Michelle Gadd was my surgeon, and I had an oncology and radiology team. And I had lumpectomy, re-excision, because I didn't get it the first time around. And each time in between, I went back to rowing, but I changed from being a starboard rower to a port rower. And I would be back like 10 days afterwards, and I'd get back into it. And then I had my radiation. Of course, I was tired. I went back. My kids were in all these sports, the normal thing. So I kind of I kind of blew it off, I guess. I remember being in radiation and thinking, gosh, why am I here? Like, everyone else here seems like their cancer is worse than my cancer. And so I kind of felt a little guilty about it. And I kind of poo-pooed my own cancer. And I didn't really connect it that much at the time with my mother's journey. So, the trauma started to begin there, but I ignored it. And then in November of 2016, I had a very invasive surgery that was non-cancer related at a different institution. And that surgery affected my whole right thoracic side of my body. It also ended up with complications with my voice. I ended up with vocal cord paralysis and a few other things. And so as I was recovering from that surgery, I still, here I was a consultant. I wasn't making money because I wasn't working. I really was thinking I need to get back into work. So in about April, so 6 months later, I'm like, okay, I'm going to get back into work. I talked to the VP. And April was the time for my yearly mammogram at MGH. So I go in for my mammogram, not thinking anything of it. And then, bang, second diagnosis. So at this point, I'm like, wow, this is really interesting. And, my mother had cancer twice. And so you can't help but reflect, with your family history. And of course, I've had all the genetic testing, nothing to tie back to anything from the genetic side. And I think that's when I started, losing it, basically. I started losing it with my other surgery, but this really kind of took me for a toll. But yet, I still wasn't doing anything about it. Emotionally, I was really in the abyss. But I kept trying to, surger on with responsibilities, though I wasn't working. So my mind was off, kind of crazed and foggy, and I kept blaming it on anesthesia. But then, months are going by. I'm like, well, can anesthesia affect you that long? So then it was Blue Cross Blue Shield had called, and they had the nurse practitioner to check in on you, and then they had the behavioral case manager check in on you. And their persistence in checking in on me and me feeling guilty, calling back, and then finally I agreed. I said, okay, send me the list of all the licensed clinical social workers I can look up in a 50-mile radius. So I got 27 pages. And then out of that 27 pages, I happened to pull out my psychotherapist who's here today, Deborah Hughes, because in all the descriptions, she was one of the only ones that had the word medical in there. And I'm like, okay, this is the person I'm going to choose. And by chance, she happened to have a practice in Methuen, Massachusetts, which is where I live, so bingo. And it turned out that we were compatible with each other. So in July, I started seeing a psychotherapist. And along this journey, I've been I'm still in physical therapy for a lot of stuff going on with my, I forgot to tell you, I ended up having a bilateral mastectomy with no reconstruction. Sorry about that. I'm in physical therapy, voice therapy, massage therapy, which I have here at Mass General, which is great because my massage therapist can look at my records and see what my physical therapist is saying, and see what the doctors, what the MRIs are, or whatever. So there's a nice connection there. I've done acupuncture. That didn't work for me. I've done Tai Chi, Qigong. So I've tried to take advantage of everything. But art therapy is what stuck for me. And Meg is my art therapist. And great. It's been a great, for me, the art therapy and the psychotherapy, I have, 3 times a week, basically, something to do with my mind. And it's been very, very helpful. Sometimes I hate to admit it, but I do have PTSD. And I do think there's a little bit of a stigma about it. And I think a lot of us think that we're not going to get it. But I realized I had no control over it. And I think that's where I'm going to stop with my story.
And thank you for sharing that. Iris, how about you?
All right. My name's Iris. I'm a 30-year-old two-time cancer survivor, ovarian cancer specifically. As Bob mentioned, I worked in the legal field doing real estate for about 10 years. Loved it. I mean, I didn't want to change it. I wanted to go to law school. I had dreams of becoming a lawyer. And in 2015, late year, I was in Panama City enjoying myself, went to rent a motorcycle. I'm a biker chick. And I went to rent a motorcycle to enjoy the beach, and the guy told me, well, congratulations. I'm like, congratulations on what exactly? He's like, oh, I thought you were expecting. And I'm like, okay. I noticed something was wrong with my stomach, but I didn't put much mind to it. My menstrual was off also, but you don't think that, stress levels, you just think it's normal. So I decided to go see my gyno, and with one of my exams, he's like, okay, so we're gonna have you come back and I'm gonna do an ultrasound. I felt something that wasn't normal, so we're gonna do something there. And so I went back, and he then referred me to, the first time I was introduced to this word, oncologist. I'm like, oncologist? Okay. Looked it up, and I literally lost my breath. And went and met my first oncologist. Sat down, we did a scan. They told me I had I just referred to it as a teratoma, because that's what it really, terror is what I felt. And so with that, he said, we're gonna have to remove your right ovary and your fallopian tube. I'm like, okay, all right, let's do this. We did it. 3 months later, I had a recurrence at stage 4. At this point, it came back at the same location, wrapped around my aorta all the way up to my chest. And yeah, very scary. I didn't relay the message to my family about stage 1A cancer. I didn't feel like it was necessary because I thought I was gonna be okay. I didn't follow with chemo. Usually what they do is do the surgery and then refer if you wanna have chemo, and who wants chemotherapy? So I said, I'll do the surgery and I'll wing it, basically. And 3 months later, that's what happened at stage 4. And here, how it came to that, I was in a lot of pain for about 2 months working at my real estate office. I had just landed this great job in Woburn, working as head paralegal with assistants. I mean, I felt made it big. I was like, I made it in a way to where the next step is gonna go to. And so I was in a lot of pain for 2 months. I have a high tolerance for pain, so I didn't think much of it. And one day I just called my mom. I said, Mom, I can't anymore. This pain is intense. It's not right. I was seeing a chiropractor. I thought I put my back out dancing or something, because I did do a lot of dancing, so I didn't think much of it. And the chiropractor's like, I don't think this is your back. Maybe it's something else. Maybe you should see that oncologist. I was like, okay, maybe you're right. So I didn't. I just kind of held back. I didn't want to hear the words I didn't want to hear. And so here I am, call my mom. My mom picks me up. We go see my doctor in Danvers, because that's where I was being checked and monitored. And we went there, and he said, I need you scanned. So I needed to go immediately to Mass General. I was scanned, and they kept me overnight. My mom couldn't understand why. So they came in the room the next morning, and they said, well, and I mean, everyone looked like a ghost. They were petrified to tell me what they were going to tell me. They're like, well, you have stage 4 cancer now. My mom, I remember, I won't forget, looked over and said, what? So with that said, we went on to a really intense treatment. From there, we started immediately 4 rounds of chemo known as BEP, bleomycin, and etoposide, and cisplatin. I won't forget those. And then 3 surgeries. I considered all the surgeries I went through with cancer, even if they weren't big, major surgeries, because it's something else that cancer is putting you through. So to me, it's a big deal. Went through 3 surgeries. After the 4 rounds of chemo, I got a little break. then went on to doing the removal of my reproductive organs, which was the toughest part for me. It was all tough, but that hit a spot I wasn't ready for. They removed everything. I wasn't left with any of my reproductive organs. Then it was the removal of a tumor that was the size, I believe, of a golf ball in my chest. And with that, I had to sacrifice my left vocal cord nerve, which is, now I'm speaking with a man-made voice and not my voice I was born with, as I refer to it. I sound like Minnie Mouse. I believe the people I worked with, Katrina and Megan, experienced it. I used to call it my Barbie voice. And so the removal of that, and then my 2 stem cell transplants. I endured both of those. I was lucky to be able to use my own cells. I produced enough. Then we went on, and last surgery was for obtaining a voice to be able to be heard with, which I'm very grateful for. And now, after all that, I realized when I went back to work, it wasn't for me anymore. And now, as Bob says, I'm flying the friendly skies. So that's a little background on me. And I'm a dog mom to a beautiful terrier named Hero, who's my emotional support pet now.
That's awesome. And as someone who has to make a living with his voice, you have a beautiful voice.
Oh, thank you.
Sound great. Guillermo.
Well, before I say anything, I just seeing all of you and just want to know how many people here are caregivers. Raise your hand. And how
Caregiver.
many people are cancer patients? Thank you. I was born curious, like probably most of you. So curious that I realized that trauma was a big thing in my life, especially being the younger sibling in my family in a country that was going through a civil war. So curious and trauma came together, so that kind of informed my profession. I became an artist, I became a psychotherapist, and I did organizational consulting, organizational development work. I work in corporate America doing diversity work, issues of oppression, gender, race, sexual orientation, etc. I also realized that most men are really oppressed to the point that they're not even showing up here in great numbers for some reason, and that most of the practitioners are women rather than men. So I also feel alone in many ways. Cancer has been a wake-up call for me to realize my mortality, to realize myself as a spiritual being, somebody that needed to wake up and deal with reality of what is really going on in my body, in my family, my relationships with my family, relationship with friends, relationship with my spouse, and how to really address that in a really positive way. In terms of the cancer, I have sarcoma. There are right now, according to my surgeon, hundreds of little cells in my abdominal cavity. Out of those hundreds, there seem to be 5 that are starting to grow very fast. This is after the last surgery that I had in 2017, after some radiation that I have in 2017, after 2 chemotherapies in 2017 and 2016, after a surgery, all of this in the abdomen, that basically mess up my private parts, as they say, in terms of the nerve, because the first tumor was what they call the sacral coccygeal space, which is basically as deep as you can go inside the spine. And that was the first surgery in 2013. So from 2013, I've been in this journey of trying to figure it out what to do. I have been very fortunate in my curiosity. I was into meditation, into yoga, into art, into doing all the things that I could do to take care of myself and to teach other people to take care of themselves. So I feel really fortunate. Cancer woke me up to be my own patient, my own client, to really deal not with other people about trying to help them, but to help myself and to really connect with the depth of who I am. And, you know, death is something that we're not going to escape. But cancer woke me up to give me time to really address who I am, what's my unfinished businesses, really improve my relationship with my wife. I was very fortunate to have married an art therapist. Thank you, Dale. In 1980, we founded the New England Art Therapy Institute in Sunderland, Massachusetts. We have worked doing art for many, many folks. Later, we created the Center for Creative Consciousness as a way to expand the reality that the folks in the panel were talking about, that is really about creativity. Who are we? How do we express ourselves? So that's all I need to say.
Thank you.
Hi, everyone. My name is Grace Van Dyke. I'm 22 years old. So in 2010, I was diagnosed with a cancerous tumor on my lower spine called a chordoma. And I was in 8th grade. I was in middle school. So it was definitely a big life changer for me. I was just in the middle of like developing who I was, my inner self. So when I was diagnosed with cancer, it was really a big changer for who I was and who I wanted to be. So when I was diagnosed, I was in the middle of like being just turning like a teenager. So I was kind of not really sure how to deal with my diagnosis. So basically, I had to just jump right in. There wasn't really a choice for me to say, no, I don't want treatment. So I had to have 5 weeks of radiation. It was a proton beam radiation, and it was at Mass General Hospital. So during this time, my mom and dad all took me to radiation treatments every day for 5 weeks. And it was in basically January and February. So during this time, it was the winter time, so we had to wake up every day basically at 5 a.m. and travel to Boston. So it was a very long commute. You know how the traffic is on the highway. So this radiation was proton beam. I was given the option of possibly having chemotherapy as well, but I didn't really want to deal with the side effects of that. So proton beam was the safest and easiest way for me to get treatment. So during this time, I received music therapy. My music therapist from MGH, Lori, is right here. So she was instrumental in my healing and treatment. So after 5 weeks of the radiation, I underwent 2 surgeries. One was to prepare my spine, my lower spine especially, for the removal of the tumor. And so I also had scoliosis, so this surgery helped remove the scoliosis that was on my spine. So I had to stay in the hospital for 1 week after that surgery. And then after that, I had to have another surgery to remove the chordoma tumor. And so then I had to stay in the hospital for another week. So during that time, I received physical therapy and music therapy as well. So then after that, I was able to keep up with my 8th grade schoolwork because I had a home tutor come in and help me keep up with the work. So I didn't have to miss any school, which was very good. I'm very grateful about that. So then I had to jump in to high school in 9th grade. And that was a very hard transition for me because I had just came out of surgery and actually I was always involved with theater. So I did a play after my surgery when it was finished in the summertime. I went to a theater camp called Western Drama Workshop. So I did a play and then I went to the high school. So it was a big transition in life and I was trying to develop, as you hear, the new normal. And so when in high school, it was very difficult because I wasn't sure who I was after surgery and who I wanted to be So I was developing myself, and when I went to the high school, I had a very hard time like making friends because I kind of viewed myself as being different, and so I didn't really want to socialize. I kind of isolated myself in a way. So in high school, it was very difficult. And then for my senior year of high school, I actually had to have my gallbladder removed in Mass General Hospital. So this was another kind of surgery. I also was very anemic at that time because I had to go through an ERCP, which is a kind of a surgery as well. So that kind of caused an internal bleed at first. So I had to go through that experience as well. So I actually missed my high school graduation because I was in the middle of surgeries and staying in a hospital. But during high school, I also got the experience of hearing about Next Step, which is a nonprofit organization in Cambridge. And so I actually did a senior project, which is in high school where you're taking out of the classroom and given an experience to work or volunteer with an organization. So I chose Next Step. I worked with Kimberly Care right over there. So we worked together on creating a song. I got an experience to do songwriting, which was very beneficial and helped me discover who I am. And so it was a great healing process. So music has always been instrumental in my healing process. So after my surgery for my gallbladder, I graduated high school. I had a separate graduation ceremony. And so after that, I started college after I was fully healed from the gallbladder surgery. And I started college at Dean College in Franklin, Massachusetts. So now I'm just at Dean. I'm really enjoying it. I'm entering my senior year, which I can't believe. And so I'll be graduating next summer. But now I'm in an a cappella group. And I'm also making a lot of friends in college and just learning more about myself, so before I kind of didn't want anything to do with my cancer treatment and being a cancer survivor. So, but now I'm kind of learning how to mix the two worlds of like the normal in college and also being a cancer survivor and taking pride in my cancer survivorship. So that's basically all I want to say.
Thank you. Thank you.